Good morning, ladies and gentlemen. I am very pleased to see you all in Moscow. It's a wonderful snowy day today. The weather is beautiful, it feels so good, and I hope this is going to set the nice working tone for our meeting. On behalf of the Ministry of Health of the Russian Federation, I would like in the first place to greet each and every of you attending the European conference organized by WHO on using digital solutions to control NCDs. I'm delighted to note that it's the first time after a long break we have had an opportunity to meet face-to-face in person, so we can really talk directly to each other. COVID pandemic has changed our world forever. It started as an epidemiological threat, but then it immediately broke through the public health domain, but it also became the catalyst for many changes in science, research, technologies, and elsewhere. Like any other global challenge, it required the humanity to take immediate measures and to respond promptly. One of its greatest accomplishments, if I may put it so, is the dramatic change of the scientific and technological development. And today we see the galloping pace of change in technologies that indeed are changing the world irreversibly. In the Russian Federation over the past year, 12 medical devices have been registered. That's software solutions relying on artificial intelligence. The software makes it possible to take speedier medical decisions. In fact, in the Russian Federation, we're proud of paying a lot of attention to it. And this is not only true of the public health system at large. We're talking about NCDs today. And I should note in the Russian Federation, we're labeling the tobacco and alcohol products. And with the labeling system for tobacco products, we can now trace the volume of consumption we have in particular regions for specific products, and we therefore can shape the consumption prevention programs accordingly to prevent the consumption of tobacco-containing products. So we improve public health in the Constitution of the Russian Federation. Last year, they entered a whole new notion, that is public health, and the comprehensive set of measures carried out today to restrict public access to tobacco is indeed one of the most innovative ones in the world these days. Well, naturally, digitalization has gone ahead at staggering speed, and one of the most prompt and global solutions for the country was the development of the digital register, the digital platform or roster of patients who are vaccinated against COVID-19 and who have COVID-19. So today we can see every COVID-positive case in the system, and we can process a lot of analytical materials, so we take the proper medical and administrative and organizational decisions in a timely manner. Also, we are now ready to move on to the vaccination certificates with the digital labeling. In fact, this is a very important step today to restrain the pandemic. Today, the artificial intelligence is gaining a huge role. And in fact, today you are going to hear about many programs that will make it possible to gather the images from different types of devices used in medicine to diagnose communicable and non-communicable diseases, as well as for early prevention, for early detection of malignancies. And these technologies are now well established in medicine and will certainly stay there. And they have a clear opportunity to change the whole landscape of early diagnostics of NCDs. the application of distance communication with the patients, the use of medical devices or personal assistance is another area where we're developing fast in this country, as well as it's developing largely in the world. We see the use of it in combination with the electronic medical history, which jointly make it possible to approach and apply the new modes of predictive medicine. As to other aspects of digital transformation in Russia, they are developing these days the digital patient's profile. That's the customized or personalized profile, including the customized approaches and recommendations for a particular patient. We have just launched this, but we see that there is a lot of promise in this area, including the combination of screening programs for NCDs, the information of the risk profile for the patient, and also the follow-up and support to patients who are already living with chronic non-communicable diseases. So for this country, the development of digital personalized medicine is a top priority in our agenda. In fact, yesterday we shared with our colleagues a number of technological solutions that have already been implemented in this country. So right now, the major large-scale implementation is underway. So I believe in the forthcoming 2-3 years, the whole public health landscape is going to change dramatically, giving special attention to personalized medicine, relying on the big data we now have available for our patients. Now, training and education, the challenge we've faced with over the past several years has demonstrated that the availability of fast digital learning platforms is a great solution to retrain the doctors so they can address the emerging needs. In fact, the online or distance education and training makes it possible to train over 1.5 million medical experts online. This is one of the recent accomplishments. In fact, 3 or 4 years ago, this wouldn't have been possible. We wouldn't have been able to even imagine it. So this online learning facility is now an amazing practice that makes it possible to address immediate challenges in almost no time. Also, I need to stress the coordinating role of WHO and the coordinating role of Mr. Kluge of the European Bureau of WHO make it possible to be on the same page, to stay in touch, to jointly form the agenda of the same information field in no time, and to jointly implement new decisions and solutions, including the digital ones. Now, to conclude, I ought to note that in 2014, the Russian Federation, initiated by the Ministry of Health, has committed itself to support the European Bureau of WHO to prevent NCDs and control them. So for about 7 years, we've been consistent in serving this goal. Over the past years, this office has become a true hub of innovations in NCDs, thus approximating all our country accomplishments to the Sustainable Development Goals. Digital marketing of unhealthy foods, the hidden advertising of unhealthy foods, all of these things are among the top priorities for the Russian experts and for the European Bureau of WHO and for the Office for Non-Communicable Diseases. We all support this endeavor, and I would like to thank all the participants, all the organizers of this conference. I wish all of us fruitful and productive work here, and I hope we generate lots of new ideas and come over to their implementation. Thank you.